Hello and welcome back to GP Video Podcast by Nadia. So, if you remember yesterday, we spoke about what is the difference between osteoporosis and osteoarthritis. Today, I would like to talk to you about osteoporosis and how can we prevent it. So, as I told you yesterday, that osteoporosis is a condition in which the bone mineral density or the bone mass starts reducing. That makes the bones very fragile and they are very prone to have minimal trauma fractures. So, you don't get to know that you have osteopenia or osteoporosis till you get a fracture. And there are many people and many conditions that put you at risk for osteoporosis that I will talk to you about, like that I will talk about in my next video podcast. Today, I would just want to concentrate or tell you the points that we need to remember about preventing osteoporosis. So, how do we prevent osteoporosis is the topic of my short video podcast today. So, the first point is nutrition. With proper nutrition, we can prevent osteoporosis. So, what comes in nutrition? What should we get from nutrition? So, number one is enough calories, enough proteins, and most important is enough calcium. Now, what is the daily requirement of calcium for males and females? So, according to the Australian guidelines, women up to the age of 50 and men up to the age of 70, they require daily 1000 milligram of calcium. That's their daily requirement. And women after the age of 50 and men after the age of 70, they require 1300 milligram daily of calcium. Now, I know it's very difficult to calculate the amount of calcium in your food, especially for those people who are either lactose intolerant or do not like consuming dietary products, dairy products. So that becomes very hard for such people. But there are other non-dairy fortified products. What are fortified products? Fortified products are the ones that have added calcium to them. So we really need to be vigilant about it and see if we are consuming enough calcium or not. And if we are not, then we can speak to our GP and find out that how can we supplement calcium through calcium tablets. After nutrition, the second thing that we really need to look at is smoking. So stopping smoking is necessary for bone health, as it is necessary for all the other organs of the body. It is also necessary for bone health. Those people who have tried quitting 11 times, I think after that we need to contact the quit line or talk to the GP for nicotine replacement therapy for aiding us in quitting smoking, which is very, very important. Apart from nutrition and smoking, third thing is alcohol. So consumption of excess alcohol also affects our bones. So what should we do about it? According to Australian guidelines, less than 2 standard drinks a day and no more than 10 standard drinks a week is recommended. Anything more than that can be detrimental for your bone for sure, and then also for other organs of the body. So nutrition, smoking, alcohol, and then number 4 is vitamin D. So apart from calcium, what is needed for bone health is vitamin D. So vitamin D is usually the main resource for vitamin D is the sunlight. And because there has been like, according to a study that I have studied, that I have read, Australians used to have very good vitamin D till there was a large incidence or large amount, like big amount of people getting diagnosed with the skin cancers, and then of course people became very sun smart and now avoid prolonged exposures to sun, avoid sunscreens and all, like put sunscreens and all, and avoid prolonged exposure to sun. So that has actually resulted, so that is very good for preventing skin cancers, but that has resulted in people being deficient in vitamin D. So again, we should measure the vitamin D levels through blood tests, and then if we don't have enough vitamin D, then vitamin D supplementation, a little bit through the diet, because diet is not a big resource of providing you vitamin D. So a little bit of diet, a little bit of sun, and then vitamin D supplementation through vitamin D supplements or vitamin D capsules is very, very important. So there comes a combined medication, which is vitamin D and calcium combined as well. So if you are deficient in both, you can actually have a combined medication, or if you're only deficient in vitamin D, then we will do vitamin D supplementation. Vitamin D, not apart from bone, has also been connected to depression. So people who are deficient in vitamin D can be prone to have depression as well. So vitamin D supplementation is very, very, very important. Okay, last but not the least, actually the most important bit that I have come to know for preventing osteoporosis is exercise. Now, what kind of exercise? Here we are not talking about the cardiorespiratory